Hi there, my name is Dr. Jason Strandberg with Lake Minnetonka Mobile Wellness. Today we're going to talk about plantar fasciitis, and this is one of the most common causes of heel and foot pain in America and around the world. It's generally a stabbing pain that you feel under your heel or in the middle of your foot, and it's typically harder to move around first thing in the morning or when you've been sitting or standing still a lot. So basically, plantar fasciitis is this inflammation of the plantar fascia, a band of tissue that runs from the heel to the toes and splays out through the entire foot. It's the thing that gives your foot its arch and its shape. And again, it gives you that really nasty stabbing pain that makes it hard to put any weight on the foot. And it tends to get better as the day goes on or as you move around more. But it tends to get worse if you've been doing a lot of standing or walking, or if you've been sitting still for a long period of time and then have to suddenly get up. So in this image, we can actually see the plantar fascia. It runs from the calcaneus or the heel bone through the middle of the foot, and then it splays out and sends attachments to each of the toes. And like I said, this gives your foot its shape. It actually creates all the different little arches in the foot, and it also helps control and move the foot into flexion and round the toes towards the bottom of the foot. The signs that typically come with plantar fasciitis are severe pain in the heel and in the sole of the foot. And it's usually worse when you wake up or when you get up from sitting or standing for a long period of time. And again, this is a severe pain in many cases, something that makes it hard for people to walk even. Now, the causes of plantar fasciitis are not necessarily all known, but we do understand that they're mostly caused by repeated micro tears or tiny little tears in the plantar fascia. They can be caused by some bigger tears in a more extreme trauma, but in any case, the tears don't go completely through and they cause a reactive spasming in the plantar fascia, which makes it hard to fully spread your toes or put weight on the foot. Now, the risk factors include things like age. Not the way you would think. It's not older people that get it most. It's actually people in their 40s to 60s that get it the most. So middle age is the most common age range for plantar fasciitis. It tends to come with people who have occupations where they're a lot on their feet a lot. So teachers, servers, flight attendants, doctors and nurses tend to be more susceptible to this than people who have desk jobs. It is also more common in people who do exercises that place a lot of stress on the heel, especially ones where you are running and change directions suddenly. So think of basketball, tennis, soccer as sports where you're going to see this more often. Now, the diagnosis of plantar fasciitis is not rocket science. It's not super hard. In fact, most of the time we diagnose it by simply taking your history, talking to you, and doing a simple physical exam, pressing on different parts of the foot. If it is necessary, we can do diagnostic imaging, although x-rays will pretty much only show you if this has gone on long enough to cause a heel spur. And MRIs, well, they can show you a lot of the very, very small damages that could be done to the plantar fascia. It's such an expensive procedure that the value it gives you is not that great over somebody who can just take a good history and palpate the foot very well. Sometimes we will do laboratory testing in association with plantar fasciitis, because plantar fasciitis, like a lot of other problems like carpal tunnel syndrome and like peripheral neuropathies, can sometimes be related to metabolic conditions, especially thyroid problems and diabetes. Now, the treatment for plantar fasciitis typically starts on the conservative side. Non-prescription anti-inflammatory medications. So ibuprofen, aspirin, naproxen. And if those don't work, we go to the prescription ones. Along with that, we can do things like rehabilitation. So there are some exercises we can give you for your foot that will help stretch out the plantar fascia. We can put orthotics in. Orthotics are basically just inserts you put into your shoe that help reposition the foot in a way that is less painful. Massage and manipulation can help. When I say massage, I am not talking about the relaxation massages you get on vacation. I am talking about the type of massage that pro athletes get the day after a game. This is intense, it is deep, it is painful, but it is super effective at treating plantar fasciitis. Sometimes there may be a malalignment, misalignment, or some other problem in the foot, and a chiropractor or an osteopath or even a physical therapist trained in skeletal manipulation might want to manipulate those joints. In my experience, quite often people with plantar fasciitis also have a problem in the talar joint, which the talus is a small little bone that sits in between the calcaneus, or the main heel bone, and the tibia, or the main lower leg bone. And if it gets malpositioned in there just a little bit, it can make it hard to dorsiflex or plantar flex your foot. So if we can manipulate that, it will actually make your movement of your foot better and make plantar fasciitis less severe. Acupuncture is an incredibly effective treatment for plantar fasciitis. And in this, typically you are taking needles and putting them into the different parts of the plantar fascia, and it causes a release of endorphins and enkephalins and white blood cells, which will lead to hopefully tissue repair, but also pain relief and relaxation of those of the collagen fibers in there. The anti-inflammatory medications, rehab, orthotics, massage, manipulation, and acupuncture all have extensive research showing that they are effective treatments for plantar fasciitis. A newer one that we've had some success with, and a number of other people have written case studies about, is extracorporeal shockwave therapy. Now, this is sometimes just referred to as shockwave therapy, and it has been used for decades to treat things like kidney stones, and more recently to treat a number of other problems, erectile dysfunction, and certain musculoskeletal injuries. And now we're trying it and seeing some good results on plantar fasciitis. If all of those things fail, if people run a trial of a number of those conservative measures and none of them work, then we go to steroid injections. Now, steroid injections, cortisol or cortisone injections, typically are used to break up some collagen fibers and reduce inflammation. And in the case of plantar fasciitis, you have excess collagen fibers in the plantar fascia, making it tighter than it should be. So this will help eat away at some of those collagen fibers and hopefully allow the plantar fascia to relax. Obviously, the drawbacks to this are it will attack the collagen everywhere in the foot, including in your bones and other things. So we can't do a whole bunch of these treatments. It's got to be used sparingly, and you have to think about how you're going to do it and why you would do it over anything else. Lastly, surgery. Orthopedic surgeon or a podiatrist can go in there and actually make some longitudinal incisions along the plantar fascia, which then weaken it to a degree and allow it to stretch out more appropriately. Prognosis for plantar fasciitis, typically when it's treated appropriately, and that could be any of the things we talked about on the last page, the outcomes are generally good. You have full or most, if not complete, close to complete recovery, and if there is a new bout of the condition, it will typically respond very well to whatever treatment fixed it before. If left untreated, the most common thing we tend to see are heel spurs forming, which can be painful and make it hard to walk or stand. It can also lead to ankle, knee, hip, and back problems because of your altered biomechanics while you're walking. Now, at Lake Minnetonka Mobile Wellness, we do treat plantar fasciitis, and the beauty of this is we will treat it in your home or your place of work if you can't make it into the clinic. We are a multidisciplinary medical group that works to improve your health, your performance, overall well-being, and we do that with telemedicine, with house calls, and we do have office hours that we can see you in our office, but we can come to you with chiropractic, acupuncture, rehabilitation, massage, and then primary care and anti-aging medicine. We, as a team, will be able to get you well quickly, and like we said, without the stress, without having to come into an office setting. We can come and see where you're working, where you're playing, where you're living, and what's causing you to have this problem, the plantar fasciitis, and maybe work to correct some of the things you're doing in your everyday life in order for you to get better. If you are interested in having one of us come and take a look at you or talk to us about plantar fasciitis or any other major health concerns, give us a call at 952-222-7886 or find us online at Lake Minnetonka Mobile Wellness. We hope to be able to help you achieve your fullest potential.